hello and welcome to Bernama today. Thank you for staying with us. As promised earlier, we have a very special guest in the studio. We have Shah Zarak. Hello and welcome.
Hello,
thank you for joining us. As we promised earlier, we are talking about pain management, and of course, Mr. Shah is a technology consultant for pain management as well as a certified laser specialist. And you're wondering why laser? Why am I referring to him as a certified laser specialist? Because this is one of the methods to alleviate pain that you're going to share with us today. Okay, so before we go any further, let us talk about pain management. What exactly is pain management? You know, how would you describe it?
Right. Firstly, I would like to ask you foremost that do you have pain?
I do.
Okay.
I think everybody has pain, right?
So you're basically in Australia is 1 out of 5 people who suffer from pain.
Right.
But in Malaysia, it's catching up to about 2 out of 5.
2 out of 5?
Yeah, in that statistics as well.
So we're actually having a higher number of pain.
We are having a higher number of pain. That's right. That's
okay.
right. It keeps on increasing as time goes on. So what is pain management is all about? It's all about basically managing pain, right, using different modalities in medical treatments.
Okay.
Like, you know, you may not want to go up to the surgery level.
Correct.
Medications as well.
As much as possible, non-invasive, non-swallowing stuff.
That's right, that's right. And you like to, you know, basically have something which is not painful.
Yes, correct.
Which is non-invasive.
Yes.
Which does the trick.
Yes.
And which gets you, you know, right along, back to work.
Better quality of life.
Make your boss happy about it.
Right? and ourselves happy in the process.
And basically you have a better life.
Correct.
That's what pain management is all about. So it's all about how you get steps, you take little steps to reduce pain.
Okay, what kind of pain are you referring to when you talk about pain management?
Okay, there are various pains that you have. In this context, we are looking at, we exclude cancer pain.
Okay.
In this context, we're looking at sports medicine.
Right.
We are looking at pains in terms of pre and post surgeries. We are looking at areas of acute and chronic pains.
Right.
You know, any part of your body,
okay,
right, that has got a certain acute or chronic in that sense, like your arm, your head, shoulder, your back, you know, your knees, your feet as well, and cases like somebody who's suffering from diabetic neuropathy as well, has got nerve pain.
Correct.
Right. We actually help to reduce that and get rid of the pain at the end of the day.
Okay, tell me what kind of treatments are being used right now that may not be as effective for what you'll be telling us in a bit.
Yeah, sure. Currently, basically, what we have basically found out is that there are many patients who actually try to escape from surgery, right? Try to elude away from surgery, and that is the one of the what we call it modality that's available besides medication.
Because logically, you would think that if you have pain and you go for surgery, you would actually add on more problems. I don't know. I mean,
would you go for surgery?
No, I wouldn't.
Right. So basically, how it's practiced now is that a lot of treatment that have been used are basically alternative in that sense.
Right, okay.
Right. Many of them do not have any medical research.
Correct.
Right. So if you go to a shop, they say that you can use this particular technique to actually alleviate pains, but there is no conclusive evidence available in order for you to that it works.
Right. So a lot of people are looking for alternative medicine. Right. But right now you're saying that there are other ways besides just the traditional way. Right.
Correct. So the current treatments available is actually a medical solution, right, which is drug free, right, in the sense that how it works is that it helps you to it basically helps you to eliminate pains by penetrating under your skin up to 4 inches. Right. In fact, human beings, in terms of physical therapy, if somebody were to touch you and give you a massage and so forth, it does not penetrate at all.
Right.
Right. So you need to get rid of the, you need to get it right to the source of it.
Okay.
Right, and get rid of the inflammations that is there.
And this is using laser therapy.
Laser is one of it.
Okay.
Right. So we have a laser here.
Okay.
Right. This is basically a laser.
It looks like a massage thing.
Yeah, it looks like a shower actually.
Yeah, it does.
I just use it in my head, right? Right. You have got different lasers actually equipped with it.
Right.
So there's a protocol that sits within this.
Okay.
If you've got a back pain, you just key in a back pain.
Okay.
So what it does is that when you put it, for example, over here, right, this is basically a wrist pain or a wrist injury.
Right.
Then you let it run it for about few minutes.
Right.
And then you play it around with different
Okay.
areas.
So what does what does the laser do in that process?
Once it contacts the skin, once it's on, it basically produces nitric oxide up to about 700%. This is actually established research.
Okay, and what does that nitric
It basically
oxide do?
provides you blood circulations.
Right.
It helps oxygen to flow to your injury area.
Okay.
And basically it accelerates your healing process.
Ah, okay.
You see?
So it works based on whatever that your body is able to do. It helps your body heal.
That's right. That's right.
Okay.
So this is actually one of it. The other products that we have is basically what you call is ultraline.
Okay.
Right. The beautiful part about ultraline is that imagine right somebody has got a back or neck problems
Yes,
and that right.
correct.
You use this as part of it, but you need to basically track what's wrong with it.
Yes.
It gives you a visual. Right, a graphification that your C3 or C4 or certain areas of it has got some damage for it.
Okay,
So
what is ultraline? It's also scanning or
it's basically a
laser?
diagnostic machine.
Okay.
Right, it does prevention, diagnostic, and also treatment.
Okay, it treats as well.
It treats
How
as well.
does that one treat?
And you must be in my class. You must be on, lying there on the table in order for you to see that.
Okay.
Right, so basically, it has got a sensor.
Yes.
It's been produced by US technology under NASA. Right, whereby it detects if there's any cavity at the bone area or decompression at a particular spine area, and it basically produces an information and a graphical, and it tells the doctor or practitioners that, hey, you have got some part of your spine here is not in good condition. This is basically a degenerative process. Right. So you need to seek a certain treatment. So by having that particular information, you can use a laser, we can use our decompression tool, and you can basically use the tool to actually helps to elevate the disc in between so that you get comfortable with it.
How does this ultraline diagnose? Is it via like heat reading or?
Nope, nothing like that.
Okay.
Right. None of this process has got any effect on pain.
Right.
Right. So you don't. In fact, you only feel a bit of pressure.
Okay.
And basically what it does is that it does manual movements to your spine, right, so that it gets loosened up, so that you have got less pressure in that area of the spine without using your hands.
How immediate or how delayed is the relief?
Well, if you got a pain, I can show it to you now. You may be right immediately.
Really, you will feel it immediately?
Yeah. In fact, the beautiful part about it is that some patients feel it differently.
Right.
Some patients actually, could walk tall.
Yes.
Right. And basically, and some of the patients will have to come at least about 2 or 3 treatments before they can actually look at it. So it all depends whether how acute is it or how chronic it is.
Right. Okay.
Right, so we have to basically evaluate. Right, on the particular pain areas.
Case by case basis.
Case by case basis.
And how is this an expensive therapy to undergo?
Well, if you were to compare about expensive, right? Medication can be expensive.
Yes, of
right.
course.
Surgery can be very, very expensive.
Yep.
Insurance may not be happy with it.
Yep.
Right. But I can assure you that in this particular treatment, it saves a lot of money from insurance company.
Does this therapy come under does insurance cover this?
Oh yeah, basically in US and most of the Europe countries, they actually covers it. In Malaysia,
Not yet.
right? Well, basically it's part of the physiotherapy, treatments.
Right.
So it's basically covered in that sense.
Okay, so that's good. This is an option that people should explore if they have severe chronic pain, even a little pain, right?
That's right.
Okay.
That's right.
Sounds good. And it sounds a bit too good to be true, but it sounds good.
Okay, just to answer that, right?
Yes.
We have statistics to show
Yeah.
that up to neck pain, almost 100% of patients actually got much better.
Wow.
Right, so this is a proven statistics in that sense.
Are you already peaked to want to go and try this out? I sure am.
Yeah, and for example, like chronic back pains,
Yeah.
right? We have up to about 70%.
Yeah.
So average patients that we have actually did in the recent study was that average above 70%.
But you were also telling me that this is something that you brought in from Toronto, and you guys have had success there as well, right?
Yes, yes. In fact, we have quite a number of, one of the cases just to mention, in Malaysia, I've got a patient who is basically arthritis patient on the knee. Right, this guy can't even walk up, his flights of stairs. 2 weeks under our treatment, he could actually walk up Batu Caves.
Wow.
272 steps.
Amazing.
You need to check it out in our video that we upload on YouTube, right? Basically, his life's testimonial on how he actually achieved it. His wife don't believe it at all.
Right. This is literally changing a person's life. And if you want, we're running out of time. If you want to find out a little bit more, there's actually a website that you can go to. It's called www.painmanagement.my. All the questions that you have, you can put up there. I'm sure a lot of information is available available, and it's already available in Malaysia.
It's already available. At the moment, it's available at Ampang Putri Hospital. We are coming into one of the big physiotherapy groups.
Okay.
And also in IJN.
IJN as well.
IJN as well.
So look out for it. Check out the website. Find out more about it, because if you're living with pain, you don't have to. You can actually find a solution for this, and look out for Mr. Shah Zarak, because he's going to be able to alleviate your pain. That's all the time that we have for Bernama today. Thank you very much. We will see you again tomorrow as usual.
Thank you.
Thank you so much.